Welcome everyone to today's webinar. My name's Annie. I'll be facilitating the discussion today. We're really pleased to welcome our guest speaker, David Pearson, who's the CEO of the Australian Alliance to End Homelessness. So thanks, David, for being with us today. I will introduce you properly in just a moment. But before we get started, I'd like to acknowledge that we are meeting on Aboriginal land and acknowledge the traditional owners of the land on which we're meeting today, which for most of us, I believe, is Larrakia country in Darwin, and pay my respects to elders past and present, and also extend that respect to any Aboriginal and Torres Strait Islander people who are joining us today. So for some context, NT Shelter has recently started a webinar series, which is really exciting. So far, we have hosted 3 or 4 webinars over the last few months, and we're really thrilled to continue the momentum with today's session, which focuses on Advance to Zero, which I'll leave David to explain in more detail, but very briefly, it's a national initiative of the Australian Alliance to End Homelessness that supports locally based collaborative efforts to end homelessness with a focus on initially on people who are rough sleeping. Which I often say to people, you know, in the Northern Territory, we speak a lot about severe overcrowding as the bulk of the statistics around homelessness. But even if you remove that from those homelessness statistics, we still have 9.5 times the national average rate of rough sleeping. So it is significant here across the Northern Territory. David and I have had a couple of conversations now about Advance to Zero and how it could work in the Northern Territory, given some of those added complexities here when it comes to rough sleeping. So I'm really eager to see that we've got good attendance today and eager to have a bit more of a conversation with people who work here in the Northern Territory, particularly in the service delivery space, so that we can get some of those local insights and thoughts. So as I've alluded to, our speaker today is David Pearson. As mentioned, David is the CEO of the Australian Alliance to End Homelessness and has worked across the community sector, government, university, the philanthropic sector towards the goal of ending homelessness in a range of different roles. David is also a Churchill Fellow, and in a moment what I'll do is drop a link to the report that David did as part of his Churchill Fellowship. So today, David will provide an overview of Advance to Zero and discuss its relevance and potential in the Northern Territory. We'll also have time for Q&A, so feel free as the conversation and presentation happens to put your questions in the chat function, and then we'll have a bit of a Q&A and a discussion at the end. We'll record the session. I think it's already recording, is it, Lauren? Thumbs up. Yeah, great. Okay, and then we'll share that recording with members who haven't been able to attend and put it up on our YouTube as well. So if you prefer not to be in the recording, just turn your camera off so that we can't see you. So David, with that, I might hand over to you and I'll pop myself on mute. And if everyone else can just make sure you're on mute as well, that would be fabulous. Thanks, David.
Sounds good. Thank you, Annie. Great to be here. Very long introduction to me, but you left off the most important part, which is I'm a former Territorian. So I grew up in Alice Springs. So just so
I didn't want to harp on that too much, but
no, right.
I'm sorry.
Yeah, there you go. Anyway, thank you for having me. I've got lots of slides, so I'm happy. Like as Annie said, do think about questions and put them in the chat. But if I say something and it doesn't make any sense and you want to just stop me, we're a small group today, so feel free to stop me and we can ask questions along as we go along as well. So with that in mind, I'll take you through it and really looking forward to sort of discussing this at the end. So can I just acknowledge I'm on Kaurna country here in Adelaide today, pay my respects as well, as Annie just did. So I guess my work involved in homelessness started many years ago, as Annie was saying, but I think in my current role, I really got stuck into this Advanced Zero work when I met this person, Jack, not his real name, but he was experiencing homelessness in Adelaide and sat in front of this sign that I just thought was really telling. But he had a lifelong experience. He has had a lifelong experience of homelessness. Started in his youth, with he had some trauma, and then that led to not really engaging with the education system. Then spending time in and out of the alternative care system. Eventually led to some homelessness, and then was able to get access to some housing, but couldn't get access to the mental health support that he needed at the time. And so the housing, he ended up getting evicted. And then later on, he got access to the mental health support he needed, but couldn't get access to the housing. And then this cycle continued. And there is a lot of people who've got this experience of what we often call chronic homelessness, people who've got a long-term experience, who have got a number of different multiple issues going on in their life. And there's someone like Jack in most communities across Australia, who spend a lot of time in the public domain. And then ultimately, we don't talk about this as a country very much, and we don't measure it very much. But the exit point for people like Jack is generally death. Early life expectancy, the life expectancy for people like Jack is 40, if it's 30 years younger than those of us with stable housing. Many of the illnesses that kill people like Jack are preventable as well. So, not all things that I need to tell you all about in the Northern Territory. You know this, you work in the front line a lot. But how do we measure this, and what do we do about it is the focus of what we want to talk about today. So in Australia, as Annie was sort of saying in the statistics he had before, we don't really measure how much homelessness there is much. We have the census data that tells you the overcrowding figures and the rough sleeping numbers and those sorts of things. But the latest data we have as a country is from 2021 to 2025. Even the day that the census data was released, it was nearly 19 months out of date. So it's not particularly useful, and it said that there was a reduction in rough sleeping overall in Australia. I think that's because we know the data was collected during a pandemic, right? So if you break that data down as we've done and focus on rough sleeping and try to collect better data, what we know is there's about sort of 80% of people who have an experience of chronic homelessness, people like Jack who are in and out of the system constantly. So there's a relatively large group out of the rough sleeping cohort, but a small cohort out of the overall problem of homelessness who have this chronic experience. We know that it causes excess mortality or early deaths, as I was talking about. The even more frustrating thing is that actually we know that the business case for investment here is the strongest, that it actually saves money for taxpayers across the health system, the housing system, the crisis accommodation, justice system to provide the permanent supportive housing that we know works. To leave people cycling in out of this experience of homelessness. So if I haven't depressed you enough. That's enough. That's the problem. We all know that quite well. Our mission as the Australian Alliance is to put a stop to that. Say, hey, we actually can end homelessness for people like Jack, that chronic experience of rare, and make it rare so that there's not much of it. There's very few people who are having that long-term experience of homelessness. We can make their experience of homelessness brief, so we're able to rapidly rehouse people like that when they come into the system, and we're able to make it non-recurring, so they're not cycling back in. That we're better linking up the health services and the other supports that's needed to sustain housing or to prevent or to sustain tendencies to prevent homelessness in this kind of homelessness in the first place. So rare, brief, and once off. That's what we mean by ending homelessness. It's not that we're going to end all homelessness overnight. We're realistic about that, but it's a strategy for saying this is what the outcomes of our system should look like. So that's what we're trying to do as the Australian Alliance. There's sort of three components to our strategy, which is the Advanced to Zero work we're going to talk about today, a series of allied networks that we work with around the country, and the health system we do some work on. We're running a national health forum next week in Canberra, and then the system change solutions. So how do we bring solutions to scale that works around common ground or mandatory inclusionary zoning and those sorts of things. So the work is really informed, though, by what's working. We know what the problem is, but there are solutions for what works around the world. And we've really done a lot of work to work with those communities and figure out how to apply that in the Australian context. And it is very much a place-based approach, and that's why I think it's really exciting to be talking to the Northern Territory as a community is particularly unique in the Australian context, but something that I think if we can take the lessons from around the world and apply them in the Northern Territory, that's something that a lot of the rest of the country can benefit from as well. So just a quick run through from what's working around the world. You're probably familiar with Finland, who has the housing first approach. They've been driving reductions to homelessness for decades. And they've used a housing first approach. They've put that principle of housing first in their policy and their investments. And that's really what we're trying to mimic here. But Australia is not like Finland in the way that many other countries are. So the housing first approach definitely is applicable for us, but they have been investing. They never stopped investing in social housing. They have been increasing the income support payments for a long period of time. That we just haven't done any of these things in Australia. The cautionary note about Finland as well is they just had an election, and for the first time in decades, their homelessness numbers went up. And the election result was because they elected a conservative government that decided to cut income payments in Finland. And so, even with a housing first policy, they've seen homelessness start to increase there, which is utterly depressing, given it's such a shining light of homelessness practice around the world. So anyway, Finland is a lot to be learned, but we're the country that we're actually a lot more like, that it's painful to say, particularly in the current environment, is the United States. They are a very large country. They have very large diversity in their approaches to homelessness. Washington, D.C. is where the President of the United States is currently trying to arrest all the homeless people. But there are pockets and parts of the US where they have ended homelessness, particularly for people like Jack or for veterans. So they get that chronic homelessness, sorry, like Jack. So they have 19, so I haven't updated the slides. It's 19 communities now that have made homelessness rare, brief, and once off. And when I say a community, it would be a local government area or a place like Alice Springs. They have done it, or not Alice Springs in terms of all the challenges Alice has, but in terms of geographic size and those sorts of things. Anyway, so 19 communities in the US. Canada is a country that we're even more similar to. They have 4 communities now that have done this using this, what they call Built for Zero. We've adopted called Advanced to Zero. So how do they do it? They took the problem of homelessness and made it from being unknown to known. They sort of got better data on how many people are actually experiencing homelessness and knowing them by name. So it started with what's called a by name list that you might have heard about. And so many of us as agencies, we'll have a list of the people we work with and we know their names. So you have a by name list, right? But a by name list for a community is where everyone working in the community with any touch point, whether it's the local library or whether it's the outreach service or the case management or whoever else is in the system, they all contribute to that list. And we have consent and privacy protected to make sure that we all as a system know what the names of everyone experiencing homelessness are and importantly, what their needs are. So start with knowing who's actively homeless, then track where are they going. Are we getting them into housing, or are we just losing touch with them, what we'd call inactive? Or are they, anyway, they're getting housed or they're moving inactive. Then there's inflow, which is where are people coming from? How are people returning from housing, and why is that? And when you understand that, you can seek to address why those tenancies are failing and measure and track that as a system. And then also who's brand new and who's just returning from inactive, who's gone to jail and come back out, or who's moved from a different part of the whichever community we're in. And say we're in Alice and they've moved to Darwin and then they've come back to Alice, or they've gone to a remote community and come back. You track the inactive, active kind of numbers so you know what's happening in your system. Just by collecting data on this, they drove massive improvements to the way homelessness was coordinated and responded to in many communities. So that's the sort of basic principle of a by name list. The real benefits are it lets you triage. Not only do you get to know everything of what's going on in your system, which has obviously got some clear benefits, it helps you triage the scarce housing that you have. There's not a community in the world that doesn't have a shortage of housing. I know we have a massive shortage in Australia, and particularly in the Northern Territory, but you do have housing. It's just not enough. And so how do you use the limited scarce housing resources you've got as effectively as possible? Make sure that it's going to the most vulnerable, that we're allocating the support to go with that. Then you can also do prevention work. Like if you're tracking this system and you can see the inflow is coming back from people you've housed, why are those tenancies failing? How do we make sure we sustain them so that we're not having people back into the system and seeing that churn? And then also, when you know what the demand is, you can hold government to account and say, this is the amount of support dollars we need. This is the amount of housing. This is the type of housing that we need that so rarely we're able to do. We sort of generally estimate that at a large level, and the economists like doing it at a big level. But what does it actually look like in a particular community and the types of housing that are needed? A by name list gives you as a system, not just as an agency, the ability to advocate for that, and also for government, if from the government's perspective, to plan for that. So government would call it system planning. In the sector, we'd call it advocacy, but it's the same outcome, right? How do we get the data that we know of what the people in the system need? So that international experience, they took an unknown problem, made it known. The other key thing they did is took it from a fragmented system to a much more collaborative system. So in the United States and Canada, they have this thing called continuums of care, coordinated access. We don't have any conceptions of this in the Australian context. What we do have is different policy settings in different states, and the Northern Territory government have just in their strategy have talked a little bit about this. But what we've done collective or generally in Australia is just try to take a collective impact approach to get everyone in the system working together with a common strategy. Happy to talk more about what that means. The slide on screen just shows the kind of common factors of what a collective impact initiative kind of looks like. So we've said take a fragmented system, make it more collaborative. The other kind of key lesson from the US and Canada and others is don't just see this as a problem of scarcity. Of course, there's scarcity. There are not enough resources. There are particularly not enough resources in the Northern Territory. But every system can get better with the existing resources it's got, and improve the effectiveness of what we're doing. And data and collaboration really drive that. So often what we like to think about is the technical space is the work we do in service delivery every day. The structural space is the things that governments do and our advocacy. But AtoZ really tries to figure out how to focus on that middle bit. How do we as a system work better, not just particular agencies in a place? And when you focus on that in a collaborative way with really clear data, even without additional resources, you can drive improvements and significant improvements often in local systems. And then the last one is don't just think about symptoms, to think about as a system, to not just respond to crisis, but to be more proactively. And that is really hard to do when we're in a national housing crisis, when we're in a homelessness crisis, when we've got overwhelming demand that is even more overwhelming in the Northern Territory than it is in other places. But there's got to be a space to carve out to say, how do we focus on the system? And one way I like to think about this, and we often talk about this as the Australian Lions, is it's a little bit like the story of the elephant and the five blind men. I don't know if you've heard this analogy before. Apologies to people who have. I think Karen's heard this before. But essentially, the elephant walks into the village and one blind person says, oh, it's a rope, and they're holding the tail. And another person says, oh, it's a tree, and they're holding the leg. And from their perspective, what they feel is accurate, but they're blind and they're not sitting back and looking at the whole thing. This is an elephant. So if you're in outreach, you definitely need more outreach funding. If you're a case manager, you need more case management funding. If you're a housing provider, you certainly need more housing. And every one of those perspectives is right. But how are we sitting back and going, what does this system need to actually get better outcomes and solve the problem that we're trying to work on? The by name list is like the elephant. It helps you sit back and look at the whole system and give really good, clear data. And so you can inform your advocacy, inform your improvement and your collaboration efforts. So when we say think of the system, it's like think of the elephant. I don't know if that's helpful. It's really hard to it's very esoteric, I know, but it's really hard when you like think of the system that we're working in. What is that? Like I'm just, X agency working on this. It's like that I find is helpful. The last kind of insight from the United States that we sort of tried to apply here is that the importance of counting down. So that goal of ending homelessness and making it rare, brief, and once off. So we learned a lot from the US and their 100,000 homes campaign they ran, where they created the first by name lists and got everyone who was experiencing homelessness, and they got access to 100,000 additional properties. And they have actual annual homelessness data counts in the US. So when the data came out, they got 100,000 new properties into the system. They expected that homelessness should decrease by 100,000 people. When the data came out, does anyone know how much they were able to reduce homelessness by? Oh, you're all on mute, but it was 40,000. So 100,000 new properties in, but homelessness only reduced by 40,000. And the key lesson from that is that you've got to count down to the outcome of ending homelessness rather than count up to the output of housing people, because people return into homelessness and people's tenancies don't sustain and people move out and all the other things. It's a dynamic, constantly changing problem. And we want to measure an outcome, not an output. And as much as housing is an outcome in our day-to-day service delivery, for a system, housing people is not the outcome. Ending homelessness is the outcome. Ending homelessness being rare, brief, and once off. So that was a really, really fundamental key lesson that we've tried to apply and that has really transformed the way that many communities around the world are thinking about this problem of homelessness. How do we count down to the goal of ending homelessness? So in the Australian context, how we sought to modify the American and Canadian approaches and all the rest of this, we've said we're going to focus on rough sleeping and that we'd start with that. And that the goal is housing and using a housing first approach. So when someone gets housed, if they move into temporary accommodation, that's not housing, that's temporary accommodation. So we keep them on the by name list, and they move into housing when they have a housing first approach placement, and you get permanent housing. I think probably, obviously, quite self-evident why that's important. And then, of course, you can do all the other things in the Australian context around triage, prevention, planning, and advocacy. So one key thing we've changed to the binary list in the Australian context. This is all the communities that are now participating in Advanced to Zero. You can see little red dots everywhere. The communities that we don't have participating is the Northern Territory, Tasmania, and the ACT. But we are having conversations with all three, and including you guys today for the Territory. So really interested exploring what does it look like to have some A to Z communities in Australia. And I think one of the things we're really interested from a national perspective is when you start building more by name lists, they connect to each other as well. And we can get a sense of when people are moving between jurisdictions. And, being in Adelaide, I know the Adelaide Zero Project, my hometown. There are a number of people on that by name list who are regularly visiting the Northern Territory or experiencing homelessness in the Northern Territory. Rough sleeping, particularly, is a particularly mobile group of people that we can make a greater case to the Commonwealth, particularly for support to address this when we've got better data. 29 communities are regularly reporting data, a part of the movement at the moment. We call it a movement of communities that are seeking to do this work. And 18 communities are regularly reporting data. At different points in time, we've achieved a shift reduction. So in an Australian context, shift reduction is a statistically significant change in the way the homelessness system is operating, where we've driven reductions for 5 months in a row. Not all, actually, all of them have not sustained that, which is important to be transparent about. Like, there is a housing crisis. We can drive improvements and we can make greater data and get better outcomes, but ultimately, improvements happen from the collaborative work we do. Better data helps us plan and everything, but we need governments to have our back here and to be investing at the scale as we know. So there is a structural problem that this won't solve without government, but our efforts in this A to Z work will help. Is the argument we make, is to help with the advocacy for the structural side. Anyway, sidebar. 3 communities have got a shift reduction, and not insubstantial. Across the movement, more than 4,000 people have been permanently housed through a collective efforts of Advanced to Zero initiatives around Australia. So when we say there's no housing, and there is mostly no housing in our work that we do, there's just not enough housing. There are placements and housing getting supported and sustaining that and doing that better. So anyway, that's kind of key outcomes we've got. I'm just going to run through a little bit more the sort of the detailed theory of what we're doing in the Australian context. So we've developed what's called a framework. So the Advanced to Zero framework sets out what are all those lessons that we've learned from around the world and how do we do this? Because this is a really complex problem that's constantly changing and every community is different. So we can't come to you as the Australian Alliance and say, this is how you do A to Z in the Northern Territory. You guys have to figure that out. We can support you and walk alongside you on it, but the Northern Territory, the people in your communities, and even like the Northern Territory is very different in Katherine to it is in Alice Springs to it is in Darwin, right? So, or even remote communities. So it needs to be applied in a local context, in a local way with local knowledge. So it's a framework that's descriptive, not prescriptive, is what we say. So anyway, just to run you through it, start with a common strategy. Try and make homelessness rare, brief, once off. There's a bit more definitions there. How do you measure what rare, brief, and once off is where we say functional zero. So it's just a way to measure that outcome. Happy to talk about that, but most of the time it confuses people, so I wouldn't worry about it. The next is take a series of interconnected ways of tackling this problem. Like this is a constantly changing thing. So we need to take a housing first approach, which we've defined as a housing first systems approach. We need to put people at the heart of this work and engage lived experience. We need to drive improvements using data and work in a place-based way. And we need to do all of those things at the same time as we drive prevention, have assertive outreach, have common triage, have a by name list. Youth service coordination, which is how we get everyone around a table to use the data to drive better outcomes. Advocate and advocate particularly for the type of housing and support we need, housing first programs and those sorts of things. So that's nice and complicated. Gets even more complicated. How do you implement it? We say implement that through improvement cycles. I'm running through this really quickly. There's a bit more background on this in the Churchill report that Annie shared in the chat. But I get that's a lot. All I would say is a framework, and we can give you the framework and you can work through that in your own time. But at its heart, what A to Z is about saying, how do we work together in the Australian context to Have everyone working with a common strategy to achieve a similar outcome, those sorts of things. How do we build a local by name list, what we've talked about, and how do we use that in a housing first service coordination forum? So what a housing first service coordination forum is essentially, you probably have a lot of these things already. Most communities, we're getting together and trying to coordinate our effort, but how do we make sure we do that in a really intentional way, that we've got clear data? When you put a by name list in the middle of those service coordination forums or care coordination, or it's called different things in different places. How do you make sure you've got really good data that you put in the middle of that table? And how do you make sure that table is supported to have the right people there at the right time, to have the right conversation with the right data? That takes time and effort. That takes resources. That takes someone coordinating it and thinking about the elephant while you're doing it. So common strategy, by name data, and a service coordination forum. That's really what AtoZ, sort of the core kind of components. And when I had a look at the sort of Northern Territory strategy, like I think it aligns pretty well. Like the system improvements that it's seeking to change, like it is thinking about local systems, right? And yeah, so just to run through a couple of them, the regional plans thing lines up with that common strategy. And one of the things we do as the Australian Alliance to support communities through this work is provide coaching and templates for what a common plan might look like, how to do your sort of local systems theory of change, or driver diagram, we often call them. That has been really pivotal to how some of the other communities around Australia and the world have really got everyone on the same page and make sure that everything links up to, all the activities link up to, in a community, link up to the outcome we're trying to get. And then you can identify where kind of gaps are and those sorts of things. So common strategy, the housing first service coordination I was talking about before, place-based interagency care coordination is what the strategy calls it. Same thing, really. Like that's how do we get a by name list in the middle of those tables, though, will really transform the effectiveness, is our experience. Because if you try to do everything for everyone all at once, it's a strategy that has very little evidence base behind working. So if you try to do service coordination for every single person experiencing homelessness in a community without really clear data, that's really challenging. The lesson from the United States and other places is break the problem up. Don't stop there, but break it up, focus with a group, focus into place, get really good data, drive improvements with the existing resources, advocate for more, and then over time expand to other cohorts, expand to youth, expand to families, expand to overcrowding, whatever works. But you've got to start at some point in the system. And if you start at overcrowding, you can get everyone out of overcrowding into rough sleeping. So you kind of start at the bottom of the system and lift up is the way some people describe the strategy. I don't love calling the street the bottom of the system, but I think you get my point. Coordination, screening and common assessment. So it's worth just mentioning a little bit about the Australian Homelessness Vulnerability Triage Tool, or it's a replacement for, you may have come across the VI SPDAT, the vulnerability. I'm not even going to the Vulnerability Index Decision Prioritization Assistance Tool. I can't remember the exact file. SPDAT. Sorry, it's been a while since I've spelt it out. Anyway, the ARVID is the new VI SPDAT, and essentially what it is a survey tool that you might have come across that helps you ask the same questions to everyone in your system and helps you get a sort of no wrong door approach, that you can ask everyone the question when you first come across them, wherever they are, put that on the by name list, and you don't have to ask them to tell their story constantly about all the different bits. It's in there, it's shared across agencies, consent is given at the beginning, and a lot of the data, we can talk about data storage, and there's different options in different places, but the data in every community so far in Australia is not government owned, it's community owned data that is held solely for the purposes of housing people. And when you get consent on that basis, consent goes through the roof, whereas consent is often hard to get when it's a government owned list and they're worried that it might be used for the purposes of a child protection notification or issuing a warrant or whatever else it might be. So having the data securely stored as a community owned asset only for the purposes of housing people really helps with consent. And then it also helps with getting common information. That's what the ARVID does. It can also help you with that prioritization or triaging, not prioritization, sorry, triaging. So there's difference in terms of the scarce resources and understanding who's the most vulnerable at a particular point in time. This slide just shows some of the value that the data can give you when you can show this data at a really local level. So this is aggregated based on VI spit out data that was collected a couple of years ago, but it shows that 97% times higher injected drug use in the last 6 months of people experiencing rough sleeping over the general population, or 7 times higher levels of depression. We can do this around disability. I think the one that always sticks out for me is the number of acquired brain injuries for people experiencing rough is just like off the charts compared to the general population. Some of these aren't, you know, surprising. They're shocking, obviously, but not surprising in terms of the figures. But it does help you understand, the nature of trauma. PTSD 40 times higher than the general public. So it's helping make the case that this is a health problem, this is a justice problem. This is, like these are the education, the other systems need to help us with this challenge of homelessness. And the data helps hold those other systems to account. You can go and have a conversation with the health system, but they've got their own problems unless you bring them data that shows, hang on, this is actually costing you guys more as a health system when you're getting all these presentations at the ED, for example. So, in summary, there's lots to all of this work. Happy to discuss. What I would say is that, yes, it's a little complicated in some of the things that I'd say, but some elements are quite simple. It's about just collaborating and getting better data to get better outcomes in your community. And how do you start this? Taking the first step is usually the hardest, but every community that has set up a zero project, and a by name list is a zero project is a collaboration of a by name list, a service coordination forum, all the different things I've talked about. Almost all of them started because the community got together and said, we're just going to do this. Very few of them have been commissioned by government. Increasingly, we are seeing governments commission these efforts because they see the value in it. But most of them was just a group of people getting together and say, hey, we're going to solve this in Alice Springs, or we're going to solve this in Cairns, or we're going to, and just start and rally the resources. So what I would say is the first step's always the hardest, but it's the most important. And when you do take that step, ask for help, because there's lots of people around the country and around the world that want to support people taking this effort. We have a series, like our role as the Australian Alliance is to bring communities together doing this work and to make it easier for you. We've developed a series of tools. We've developed a database that's useful for communities to use. And we have annually, once a year, we get everyone together. It's part of this movement. And we're doing it in November in Adelaide, which I would highly encourage, if you're able to come and if you're interested in doing this work, to come along and be part of that. There is a cost to being involved, but what I always say is if cost is a barrier, please get in touch with us and don't let that be the barrier to participation. So we'd love for you to be part of that. We also are running a series of leadership academies next year for a first time, which brings out one of the experts from Canada on this work, and he does this 4-day kind of immersive retreat that we did in Adelaide a couple of years ago. We're doing it. So that's a really worthwhile thing that's happening in February, if that, again, not in your territory though. Last thing is just sign up to our list and hear about updates about training on the ARVID or training on assertive outreach or setting up a by name list separate to the learning session that we sometimes do. And I am really grateful for the opportunity to be part of this. But essentially, this is a solvable problem. Like we've lost track of that notion when we're so consumed with the crisis-driven nature of the work that we often do. But homelessness is solvable. There are communities, as I've demonstrated, that have done it. And what it takes is communities, that is people in communities getting together and saying, we want to solve this, because there's no one agency, program, pill, building that can solve this alone. It has to be collaborative efforts between people and agencies and communities working together. With that, I'm going to stop talking, stop sharing, and I'd really like to talk about it and ask some questions and explore how this might work in the territory.
Thanks so much, David. Such a good